Hi, I'm Rebecca at Bodycraft Massage Therapy. Today's video is going to be a brief introduction into range of motion warm-ups that can also be active stretches, specifically in this case for post-breast surgery, whether it's a lumpectomy or a mastectomy. It could be also post-thoracic surgery. However, let's be clear that this is not for someone who is newly out of surgery, who's still recovering. You want to make sure you have medical clearance to exercise, to gently stretch before you do these. So if you have not had that clearance yet, you want to have a conversation with your medical team, of course, because safety is most important. It's paramount. This particular video is based on a couple of clients we have who are overseas. They come and work with us when they're in New York City, and we do video consultations with them. But one in particular, her mastectomy scar is getting really short, very tight, and her doctor, her radiologist where she lives, told her that she needs to mobilize the tissue more. Now, she's already been taught how to do self-scar work, but sometimes moving is more, feels like it's a more doable approach than working on one's own scar. So in an effort to give you more tools at your disposal to help stay comfortable in your body and keep your tissue malleable, now we have this video. All right, so again, we're working pain-free. It might be a little uncomfortable. You're not going to pass through past a moderate discomfort threshold, okay? This is, again, tip of the iceberg. This is just a small sampling of things that you could do, but let's give it a go. So because we're going to be thinking about moving through the upper quadrant, and in this case, I'm specifically thinking post-mastectomy, post-lumpectomy, axillary lymph node dissection. We're going to keep that in mind. Ideally, you're on a steady chair that's not on rollers. I'm on wheels so that at some point I can shift myself further back so that you can see my arms when they're open out to the side. All right, so here we go. Always great to start with a warm-up. And in this case, we want to make sure we prime our lymphatic system. So we're going to do 3 diaphragmatic breaths together. When I do this for myself, I usually do 5 to 10. I like to stay with that 5 to 10 number because I don't have to think too hard. I don't move through too quickly through any of the steps, whether it's the diaphragmatic breathing or the range of motion. So we're going to stay with 3s for time, just to keep things more condensed. So let me motor back a little bit so that you can see how I'm sitting. Nice and tall, shoulders are easy, hands on the abdomen. And here we go. As you take your nice full inhale, you'll notice that the belly will naturally distend out. You don't need to push it. So breath goes in. We pause at the fullness. And as I exhale, I stay nice and tall. And my abdominal wall engages and contracts. Pause at the fullest exhalation. Breath in. Pause and exhale. Pause. One more time. Breath in. Pause and exhale. Pause. All right, so that's our diaphragmatic breathing. If you're doing this for more than 3 breaths, say 10 breaths or for 1 to 2 minutes, if you notice you get lightheaded, you're going to pause, return back to your regular breath pattern, your regular tempo that you like to breathe at, until that lightheadedness dissipates. It just means you're flooding your system with more oxygen than it's used to, so you're going to be kind to yourself and make sure that you don't continue to flood it in a way that's overwhelming. Okay, so diaphragmatic breathing to start. Hands on, I like to do this hands on the thighs. It'll be seated cat and cow. The only time I would not do this is if you have osteoporosis or risk for pathological fractures in the spine. So if bone density is an issue and your doctor's told you not to flex your spine, not to curve forward at all, then you skip ahead. right? But otherwise, we're going to start nice and tall. I'm going to exhale, draw my navel back, tuck my pelvis, and let my spine come into a C shape. And then I'm going to come back up. Let me scooch so you can see a little better. Exhale. Inhale up. And one more time. And inhale up. So nice and simple. You want to make sure you come back up to vertical every time. Okay, shoulder circles. I'm not a fan of going from back to front because I feel like most of us are very forward in our modern tech world. But if you feel so inclined to do back to front, start with them, and then we'll catch you now for front to back shoulder circles. So you're going to go up, around, slide, and widen. And 2. Let's do 5 because these just feel so good. 3, 4, and 5. And then elbow circles. Fingertips on. Now I am dealing with a shoulder issue on the left, so I'm going to modify my left side to be pain-free. And you might notice that my right side describes a larger circle, and that is perfectly fine and acceptable. And then we're going to come up to shoulder shrugs. Slide the shoulders up and then widen and slide them down. I'm staying nice and vertical. My breath goes in. Exhale, stay tall, stay supported. And let's do one more time. And then you come open to the side. So now we're going to continue into full arm circles, keeping the shrug out of it. So here we go. Breath goes in and exhale. And again, my right side can go really far. Left side is not happy doing that. So I'm working in a pain-free range on the left and a pain-free range on the right. Easy breath in and out. Again, 5 to 10 times. Let's stay with 5s for now because 3 feels like too little. And one more time. All right. Next up is neck circles. So we're going to go from side, making sure we don't do anything funny with the ribs. Keep the torso nice and vertical. Side through front, other side. Ooh, weird ribs, Rebecca. There we go. Keeping the torso nice and tall. And I'm just easy peasy, nothing fast, slow and steady. Now, the reason we do include the neck is because the connective tissue that covers the front corner of the neck comes down and attaches and continues below the collarbone. So we want to make sure that anything that's coming near the chest wall has a chance. And we can hang out there and stretch, of course, 30, 60 seconds. We're going to just fast forward 30, 60 seconds, right? All right, so we've already done diaphragmatic breathing, shoulder circles, elbow circles, shrugs, and full arm circles, and then neck circles. Next up are spirals. So you're going to keep your pelvis nice and still, and you're going to think about moving from the waistline up. As we go around to the back, you want to make sure that you don't pop that shoulder forward in an effort to feel like you're going further. So, breath is in. With an exhale, twist. Pain-free range. Inhale, tall. Exhale. So collarbones on both sides stay nice and wide. Exhale, twist. And again, if you're someone with osteoporosis, you're going to be extremely careful that as you twist, you don't also flex. If your doctor has told you to stay away from twists for whatever reason, you're going to listen to your doctor. Let's do 2 more each side. Once more each side. All right. So next, we're going to do single book arm. Weird title, I know. It's the way my brain is working with this one. Hand behind the head, shoulders easy. Inhale, bring your elbow forward. Exhale, widen your elbow. You're making sure you don't push the shoulder up and you don't push so far back that now, if you can see, that the shoulder comes up, right? Elbow comes in. Exhale, I'm thinking about widening from my sternum all the way through the elbow point. Breath in. Breath out. The extension of this exercise now would be breath in, exhale, elbow, then twist. So if you have a scar across the breast, you start with the opening and follow as much as you can until that scar tells you enough. Let's do one more. Back to center. We're going to do the other side again. 3 times just the arm, 3 times arm with spiral. I'm going to take it easy on this side because I'm working with a shoulder injury. Breath in, exhale. So again, if I had scar tissue that was really tight and I'm doing one side at a time, I would probably start with the side without the tight scar tissue to hope I get some sympathetic response on the other side. So now I'm going to exhale, open and twist. And I'm listening to the tissue to tell me where my range of motion is. And on this side, it is significantly shorter range of motion, but I'm working in that pain-free range. Maybe not the most comfortable range, but still not actually painful. All right. So next up, nerve flossing. Nerve flossing is a lot of fun. It's very simple to do. It's not going to feel so muscularly. So arms are out, not quite straight side to side, but slightly forward, like you're hugging the biggest redwood tree. You're going to push one heel of the hand away and fold the other wrist in. So all the motion is happening at the wrist, and then everything switches. Ooh, this is tight after a long day at work. Switch. I'm trying to stay nice and tall. I'm being aware of letting my shoulders release down and drawing my abdominal support in and up. So after 3, 5, or 10, right, I think this is 4, I'm going to do the same thing but with soft fists. So heel of the hand goes out and knuckles come across on the opposite side. It'll feel more localized around the wrist, maybe the back of your hand, and that's okay. Again, we're reminding the shoulders to stay soft. If you need to take a break and put your arms down, of course you do. When you're ready, you start back up again. All right. And then you can always do wrist circles in either direction. All right, so next step. Now that we've done some nerve flossing this way, now we're going to add a little spiral. So our arms are back up, shoulders easy. Remember, they're slightly forward of you. One palm stays forward and the other swings back. Note the whole shoulder is not swinging up or forward. I'm just pivoting the arm in the socket. Pain-free range. Bring it back, and then the other side. Ooh, tight on that injury side. So this might not feel like it's working directly on the scar tissue, but because it's working that entire connective tissue coming across, the scar tissue is going to get a little bit of length to it, a little bit of ease. And then we're going to add our twist. So this is coming out of Pilates. If you've done Pilates, you've done this before. As you twist, the back palm is going to dip thumb down, not lower down. You're just going to do that same pivot in the shoulder socket. So I'm going to pivot, thumb down, other thumb stays up. Come back to center. And I'm trying to keep my collarbones really wide. Exhale, thumb down to the back. My hips aren't doing anything. They're staying nice and still. My abdominal support stays engaged. And I'm twisting my spine. And I'm moving my arm in rotation in the shoulder socket. Let's do one more to each side. And then we're going to come back to center. Do a couple shoulder rolls because we're holding our arms up there for quite some time. And then hopefully, now that we're coming to the end of this range of motion, you feel nice and wide across the chest, nice and wide across the back. Shoulders easy. All right, everyone, I hope this helped. There's, of course, many, many more exercises that we could do, but this is a nice warm-up to get the entire shoulder girdle moving, to get the pectoral region nice and open, and help tease open some of those fibers with gentle movement. If you have any questions, please reach out to us at contact@bodycraftmassage.info or through our website of the same name, bodycraftmassage.info. Thanks.